Namaskar, I am Dr. Himanshu Bavishi from Bavishi Fertility Institute, and today I will talk to you about high AMH. What is AMH? Please watch my other videos where I have discussed what is AMH. Normally we in infertility practice see more patients of low AMH. However, in Sanskrit it is said ati sarvatra varjayate, matlab meaning excess is again not good. Normally we don't see excess AMH, mostly we see high AMH in the patients who are called PCO, polycystic ovary, PCOD, polycystic ovarian disease, or PCOS, polycystic ovarian syndrome. So there are multiple follicles or multiple antral follicles in the ovaries of the women, which again is not good. So what we will call as high. Some people call it as 4.5 plus, but normally 6 and above AMH is considered to be high. We have seen patients with AMH of 22, we have seen patients with antral follicle count of 50 to 60 in one lady. So these are the patients who need special attention because they behave differently when we do their treatment. So sometimes we are happy that okay, we have more AMH, but again too high is also not a welcome thing. PCOD is a subject in itself, and please watch my videos on PCOD where I will explain to you what is PCOD. But here I would like to say that when you have high AMH and we are planning your treatment, the first question comes in mind is, do I need to reduce my AMH before I do the treatment? And the answer is no. You don't need to reduce your AMH because reducing the AMH will reduce the ovarian function as well, and that's not a mandatory thing for you to do a treatment. However, there is one modality is called ovarian drilling. So if you are going for laparoscopy, if you are very young, if you have not tried for a long time and other factors are normal, and then in that situation you can do what is called laparoscopic ovarian diathermy or drilling, where you will reduce the antral follicles in the ovary, reduce the size of the ovary, damage the ovary, purposeful damage to the ovary, controlled damage to the ovary to reduce some AMH and improve the response to the treatment. However, that is not the only solution. The real problem here is that there is too much of eggs but they are not produced in time, and that is where the quantity is more, quality is not there, and we have to plan the treatment accordingly. When we plan the treatment for patients with high AMH, there is always a risk of a complication called ovarian hyperstimulation syndrome, because when we stimulate the ovaries, multiple follicles develop and that may lead to ovarian hyperstimulation. So a patient with very high AMH especially needs a specialist doctor to take care of them so that they don't end up with what is called ovarian hyperstimulation syndrome. We have to highly customize the stimulation protocol, whether it may be simple treatment, IUI treatment or IVF treatment, to avoid the complication of ovarian hyperstimulation. At the same time, get good number, good quality and good quantity of the eggs. Fortunately, we have many medicines and protocols which are good for this group of patients, and which we can try and get their response safely and allow them to become pregnant safely. These are the groups of patients where even freeze-all protocol works very good if it is an IVF treatment. As I said that high AMH is more common in the patients with PCOD. Please be careful, get a diagnosis done, because AMH is not considered as a diagnostic test for PCOD. You need to go for a consultation, you need to go for sonography of your ovaries, and ovulations means irregular cycles, androgenic features means acne, hirsutism, etc., sonographic picture. All these put together, your diagnosis of PCOD is confirmed, and if you have PCOD, you be careful not only for your fertility treatment but your overall health and health in your advanced age as well. Hope this was useful to you. Keep watching. Thank you so much.